Very much, Hannah. Thank you, Congressman, for being here with us today. You just watched what we all watched with North Korea. It seems like this is escalating very quickly. What do you think about Trump's take on this? And as a person who could theoretically be asked to declare war in Congress, what would it take for you to approve of some sort of military action on that peninsula?
Well, I mean, to the first question on Trump's comments, we're at this point today. It wasn't created in the last 6 or 7 months. Obviously, I wouldn't have said or tweeted out anything to that effect. But we've had diplomatic talk from both the Obama administration and the Bush administration, and they've been working on nuclear weapons for a long time. As far as what would it take for me, I'd have to see an imminent threat. I think that's the most important part. If we see an imminent threat on us or our allies, it's what it would take to get me there.
They've talked about Guam, Korea has, and their ability that we're not really sure exactly what they could do, but they've talked specifically about Guam. Would an attack there be what you would need to consider more?
An attack an attack obviously on us as a country, the U.S., or our allies, I think is a very serious threat, and that is obviously actionable. But again, we have to make sure that we see the threat. I don't want to get to the point where there's actually an attack. I'd like to prevent attack. So the threat is where I would draw the line, and obviously the intelligence side of that, and making sure that we have good, actionable intelligence behind that.
Okay. Shifting gears a little bit closer to home now, two kind of debates that have been going on for really as long as you've been in Washington, healthcare and immigration. Just before the recess, Trump put his stamp of approval on a Republican plan from a couple of senators in the Senate to reduce the amount of legal immigration and sort of create a points-based system that would value more skilled workers, those who speak English. Mm-hmm. What do you think about that plan? Is that moving in the right direction, do you think?
No, I don't support the plan. I don't believe that plan is moving forward, and I don't think it's going to get to the president's desk.
You don't think so?
No.
Okay. What specifically do you find objectionable about it?
Well, it doesn't work with us here in the agriculture world, so that's obviously an issue for us here in the Central Valley. As far as a nation, I think that it would have a severe impact, and I think we're starting to see some studies out there, some models that have come out who are point to that and highlight that. As far as it being a bill, it was introduced by 2 members of the Senate who have introduced bills like this in the past and have not moved, so I would expect this one to have the same fate.
Do you think the amount of legal immigration should go up or down?
Well, that's a difficult question to answer. I mean, I think there's a lot of factors that have to play into that. I think we have to fix our immigration system so it is one that works and works with our economy and with the American people. We don't want to put American workers at a disadvantage. We also want to make sure that we have what we need here. I mean, ag is a specific one, and the healthcare industry is one that we need to really pay attention to. And then there are those in the technology industry who not the overall workforce, but there are times that we've missed out on real opportunities for investments here in the U.S. because a specific person who had a specific talent wasn't allowed to go through our immigration system. And so those businesses or that whole department within that large company was actually based in another country, and we missed out on a whole opportunity on a whole department within this company. And that's things that we need to look at when we make those decisions. But as far as an up or down, I don't know if that's the proper question. We have to make sure that it works with, again, our economy, with our American workforce, and that it complements our industries here so that it helps us grow and be competitive on a worldwide stage.
Okay. And then finally to the healthcare debate. We just came through this American Health Care Act debate. Mm-hmm. It ended just shy in Congress. You voted for it. Mm-hmm. You added some things last minute to the bill, but it failed. Where do you stand at this point with healthcare?
Well, we still have to pass. We have to have this debate. Every time, and there are folks in the district who oppose, and there are folks in the district who support that legislation. But the one thing that I did get from pretty much everyone that came to the office, either on the official capacity or even the protesters, was that there are issues. Some wanted to see a single payer system, and most people wanted to have access to care. I mean, we don't want our emergency rooms full. We want to be able to attract doctors into our communities. We have to make sure they're reimbursed properly. We want people to be encouraged to actually go out and buy their own insurance plans. Encouraging people to be a part of things like just the Medicaid program are not exactly ways to attract more doctors and more specialists into our area. And we need to do something to fix that. The bill did address some of that with the way that it gave the tax credits to help people, incentivized to help them buy their insurance. It was an age adjustment. I was hoping for an income adjustment in that. I think the Senate, Senator Thune had an amendment to do that. I think that would have been a really helpful addition to the bill. But at the end of the day, we have to make sure that people at home, I mean, people like myself, I have young children, my wife and I, have the ability to go out and purchase insurance, allow them to see the doctors that they want, and not be forced into a system where they end up in emergency rooms in the middle of the night and impacting our emergency rooms. And we will have to make sure doctors are reimbursed in a way that attracts them to move into our areas so that folks with insurance don't have to travel to LA or San Francisco for health insurance, but they're actually given choices here in the Central Valley. And I think that's what we have to aim for. And legislation, as it moved out of the House and was going to the Senate, our hope was that the Senate would work with us, we would come up with some more fixes, and it would come back to us, and we would move it along. That didn't happen. We're hopeful the debate moves forward. Because Republicans and Democrats, even Nancy Pelosi said herself that she's willing to work with Ryan and others with some fixes to Obamacare. Schumer said essentially the same thing. So that tells you right there, both sides of the aisle agree we have problems. It has to be fixed. So let's work together. I've always been open to that. I was frustrated that Dems weren't there at the beginning, but if they're willing to come now, let's move forward and fix this problem for the American people.
Okay. Well, thanks very much for being here with us, Congressman. We will send it back to you guys at the desk.
Thanks.